Parks, President Ronald Reagan, and recently actor Charlton Heston. They all lost their battles to Alzheimer's, and experts say 5 million Americans are living with the deadly brain disorder. Are you at risk? And can we slow it down as we age? Well, Dr. Roland Reyna with Health Texas is here with those answers. Good morning, doctor.
Good Sunday morning to you.
Yes, well, okay, so as I mentioned, we just heard about Charlton Heston, and when you hear those names, you know that Alzheimer's does not discriminate.
That's right. You know, the problem is, do you know what the leading risk factor for Alzheimer's disease is?
Could it be aging?
It's age. By the time people get 85, 50% of all Americans will develop Alzheimer's disease.
50% of all Americans.
50% by the age of 85. It's amazing.
By the age of 85.
It robs people of their souls, of their hearts, of their minds, of their bodies. It's a terrible disease.
So define it for us. What exactly is Alzheimer's?
This was initially diagnosed back in the year 19,006 by Dr. Alzheimer, and they named the disease after him. There was a 51-year-old lady who had a dementia, and a dementia is characterized by loss of memory, problems thinking, and behavioral changes. That's what Alzheimer's is. And at that time, back in 1906, the average length of life was 50 years old, so people didn't get there. But now that we're living longer and the life expectancy of Americans is 80, probably about 25% of people will have it sometime in their life.
Yeah, I read under the Alzheimer's Association website that 10 million baby boomers will probably be diagnosed with Alzheimer's.
It's estimated that by the year 2050, there'll be 16 million people, Americans, with Alzheimer's.
Wow, and it's the 7th leading cause of death right here in the United States.
Yes, it is.
Now, when it comes to Alzheimer's, though, is there anything that we can do now to slow it down?
The one thing that has been shown to be effective is education. The more somebody has an education, the more college degrees, the more graduate degrees you have, the better off you are. But not only that, the more active you are of both body and mind. So the best thing you can do is stay active, physically and mentally. Read, do crossword puzzles, stay active, talk a lot.
Now, doctor, you're saying the more education, and you also mentioned degrees. Now, is it fair to say? I mean, it almost sounds like the smarter you are, and that's not true.
No,
it's
not.
Basically if you read more and keep your mind active, right? Crossword puzzles.
It's kind of like exercising the mind.
Okay.
Getting an education is like educating the mind. So you're less. It doesn't discriminate. You can still get it, but the likelihood is a little bit less.
And as far as treatments, there's nothing really out there that we can say that's
there's medications out there called cholinesterase inhibitors. They work 50% of the time. And when I say that they work, what they do is slow down the disease process by 6 to 12 months. And that's it. That's all it does.
That's it.
That's it. Slows it down for 6 to 12 months. After that, it goes back to whatever process it would have usually undergone.
Now, diets, does that play a role?
It does. You know, the most important thing, people who have diabetes, high blood pressure, high cholesterol, people who are overweight, there's more instance of Alzheimer's with these folks as well. So I think the bottom line, you need to keep away from alcohol, you need to exercise, you need to keep your weight down. Really, people who take good care of themselves are at less risk.
Now, the older you get, say you've just reached 65 years old, now should you start reading more books? Should you start doing more crossword puzzles and reading the newspaper more often?
Absolutely. And I would say that it's probably best to be doing this your whole life long.
Got it.
A lot of times when people retire, they retire from life and they stop doing anything at all. All they do is sit around and watch TV a lot, which is actually a sign of Alzheimer's as well.
And who could be at risk, aside from age? Because I'm sure people out there are saying, well, my uncle had it, my aunt had it, so who could be at risk?
There are some genetic characteristics, and there's still a lot we don't understand. Our understanding of Alzheimer's has only developed over the past 15 years. Before that, we knew very little about it. But there is a hereditary component. If both your parents have had Alzheimer's, your risk is higher, but it's not 100%.
It's not 100%.
We just don't understand.
So we really have to do things on our own.
You know, and as you say that, about 70% of people who have Alzheimer's disease, they're cared for by the families. So the families need to learn about this because it's a tremendous, not only is it a financial burden, it's an emotional burden as well. It's very painful to see somebody who you love who's been devastated by the disease process.
Okay, well, definitely. There's a health fair that's being held by Health Texas. In fact, it's Thursday, April 17th.
That's right.
And it's over at Madison Retirement Community on Fredericksburg Road.
Right.
And it's from 9 a.m. p.m. to 4 p.m. and it's free, which is great. So if you want some free information regarding Alzheimer's, as well as maybe other things that come with aging, this is going to be good for you. And also, here's a phone number for more information. It's 210-731-4864. Well, thank you so much, Doctor.
Bring your families and have fun.
Yeah, definitely. Thank you so much.
Thank you.